Have you heard of the EBD or Ebola virus disease? This disease caused worldwide panic when it re-emerged in March 2014 in West Africa. The EBD or Ebola virus disease is a serious sickness which leads to fatality if not treated immediately. According to the World Health Organization, Ebola virus first attacked in Africa in 1976. This is a very good example of emerging or re-emerging disease.
An emerging disease is a new infection resulting from the evolution or change of an existing pathogenic agent, a known infection spreading to a new geographic area or population, or a previously unrecognized pathogenic agent or disease diagnosed for the first time.
A re-emerging disease is a resurgence in a defined time period and location of a disease considered to have been eradicated or controlled in the past.
Both emerging and re-emerging diseases have significant impacts on naive animal populations and/or public health.
What is emerging disease? Emerging diseases are diseases that have newly appeared in the population or that have existed before but is rapidly increasing in incidence and geographic range.
What is re-emerging disease? Re-emerging disease that had decreased in incidence and brought under control but servicing again due to change in health conditions of a population.
Here are some emerging and re-emerging diseases. Leptospirosis, a bacterial disease affecting both humans and animals caused by the bacteria Leptospira interrogans.
With Leptospira, lepto means thin and spira means coil. So Leptospira is a genus of spirobacteria known to cause leptospirosis, a zoonotic infection, meaning it can be transmitted from animals like rodents to humans, especially people who work in sewers and waters contaminated by these animals' urine. The Leptospira genus has over 20 species, and the most common species that causes leptospirosis in humans is Leptospira interrogans. Now, Leptospira is a tiny spiral bacteria that stains poorly with gram staining because it doesn't retain the gram dyes well, so it's classically considered gram-negative. It's also too tiny to be seen with a light microscope, so you need a dark field microscope with the use of immunofluorescence.
Signs and symptoms. Symptoms show 3 to 7 days after being bitten by the infected mosquito. This includes fever, severe joint pains in hands and feet, rash, nausea, and fatigue.
To prevent this, avoid contact with water and soil contaminated by infected animals like rats. Practice good hygiene.
Treatment: treated with antibiotic. Here are more ways to prevent leptospirosis.
Chikungunya, a viral disease transmitted by mosquitoes.
Chikun. What? What is that?
Don't worry, little friend. I'll tell you. You'll see it's hard to pronounce, but easy to prevent. Chikungunya is a disease that is spread when a mosquito, Aedes aegypti or Aedes albopictus, also responsible for spreading dengue, bites a sick person and then bites a healthy person. It is not spread from person to person, only by the bite of a mosquito that has bitten someone who is sick.
How do I know if I have chikungunya?
We should all be aware of the symptoms, which are similar to those caused by dengue. If you show signs of the following symptoms, you could have chikungunya: pain in your joints that can last up to 2 years, headache, general discomfort, and skin rashes.
And what should I do if I get sick?
If we get sick, we must immediately go to the nearest health center. If we do not get medical attention, chikungunya can cause death and can be very debilitating. We recommend not self-medicating and drinking a lot of water.
Okay, I understand, but is it true that there is no cure?
Yes, it's true, there is no cure. But fear not, because together we can prevent this and other diseases.
Yes, but how?
Breaking the cycle that spreads the disease by following these steps: eliminating places where the mosquito can lay its eggs, cleaning places where water can accumulate, using repellent and mosquito nets to prevent mosquito bites and prevent people who are sick from being bit by healthy mosquitoes that then spread the disease, sharing this information with our family, friends, and neighbors. Together, we can prevent chikungunya.
Signs and symptoms. Symptoms show 3 to 7 days after being bitten by the infected mosquito. This includes fever, severe joint pains in hands and feet, rash, nausea, and fatigue.
To prevent this, use protective clothing and insect repellents during outbreak season. Clean areas frequently inhabited by mosquitoes.
Treatment. No treatment. Treatment is primarily directed at relieving symptoms.
Severe acute respiratory syndrome or SARS, a contagious and sometimes fatal respiratory illness caused by SARS-CoV.
Like I just said, SARS, or severe acute respiratory syndrome, is an infection caused by a virus, specifically a coronavirus. This virus tends to spread when people are in close proximity and travels through droplets in the air. SARS can, however, also spread through contact with an object or vehicle that has been infected or contaminated. Now, the clinical manifestations of SARS begin with a fever of a temperature higher than 100.4 degrees. Some people experience mild respiratory symptoms, but more common manifestations include headache, general malaise, and muscle aches. Eventually, usually 2 to 7 days after initial onset, the patient may develop a dry cough, shortness of breath, difficulty breathing, and hypoxia.
Signs and symptoms. Flu-like symptoms such as fever, chills, headache, muscle aches, poor appetite, dry cough, and shortness of breath after a week.
To prevent this, practice good hygiene. Wear protective gloves and masks. Disinfect surfaces.
Treatment. No treatment yet. Hospitalization is required in severe cases. That's all, and thank you for listening.